If you are a federal employee and you are approaching 65 years old, you have a Medicare problem staring you straight in the face. Your federal employee health benefits, something that we'll refer to as FEHB moving forward, are solid benefits, but should you pick up Medicare as well? And part of what makes your decision so hard is that number one, we don't know the future, and number two, you have a bunch of different options with pros and cons to each. So let's go over the 5 main options that you have available to you in this video, and then you can decide from there what makes the most sense for you. For retiring individuals that meet all of the requirements and want to continue health benefit coverage, the federal government's Office of Personnel Management, or OPM, says that you do not need to do anything to have the same benefits continue after retirement. Those of you who are retired and qualify for FEHB and Medicare are officially referred to as annuitants. It's not a word most of us use in regular conversation, and I won't use it a lot here, but that's the phrase to listen for as you go through these conversations in real life. And these 5 options are for traditional federal employees. If you are or were an employee of USPS, you have separate Postal Service health benefits, and these do require you to take both Medicare Part A and Part B. Military is another exception. VA and TRICARE for life benefits are covered in separate videos. But for the rest of the federal workforce, let's go over your 5 options here. Please know that there are exceptions, but most people are faced with a choice between the first 3 arrangements. Also, to keep this video to less than an hour long, I'm referring to those who are retired. If you or your spouse are still employed, benefits are coordinated differently. Okay, here we go. The first option is to keep your FEHB plan and enroll in Medicare Part A only. The positives of this option are that you keep your well-subsidized FEHB coverage without having to pay anything extra for premiums for Medicare, because 99% of all Americans qualify for premium-free Part A, which is hospital coverage. As long as you qualify for premium-free Part A, meaning you or your spouse worked and contributed to the Medicare portion of FICA taxes for 40 quarters or 10 years, I can't think of a reason to not have Part A in this instance. And Part A can help lower your out-of-pocket costs if you have any healthcare needs covered under Part A. This would be inpatient hospital stays, meaning you're admitted into the hospital, some home health care, skilled nursing care, and hospice care. If you choose this option and you don't get Part A, which is the medical coverage side of Medicare, you will have to pay your FEHB copays out of pocket, which is what you've been used to your whole life. But once retirement hits, you might start to feel those copays a little bit more so than during the younger working years. The other downside to this option is if you do not get Part B when you are first eligible for it at 65, but you decide later that you do want it, you would be subject to the Part B late enrollment penalty, which is 10% per year you postpone Part B enrollment. That number is a percentage of the Part B premium that year. In 2024, the base premium is $174.70. If you delay for 2 years, that's 20% of the $174.70, or another call it $35 tacked on a month, and we'll call that $210 per month instead of $175 per month. When the Part B premium increases, which it typically does a little bit each year, the percentage penalty is based on the new premiums and will also bump up a little bit. So penalties are definitely something to consider if you foresee needing Part B in the future. If you have a lot of healthcare needs or you feel like you'll want Part B in the future, it may make sense to look at option number 2. Option number 2 is keeping your FEHB and enrolling in both Medicare Part A and Part B. In this configuration, Medicare would be your primary coverage. This means that if you have some sort of a healthcare bill, it goes to Medicare to pay its portion first, and whatever is left over goes to your FEHB plan to pay its part. And whatever is left over from that goes to you as your out-of-pocket costs. But you have that extra layer of coverage between you and that healthcare bill. Yes, you are paying more per month by picking up Part B, but remember, Part B covers 80% of approved medical costs after the Part B deductible, and then you're on the hook for the other 20%. Well, that deductible and 20% goes to your FEHB plan to pay next, which leaves you with an even lower out-of-pocket cost responsibility as these two plans work together. In fact, you may not even see a bill depending on the services that you require with these both working together. And peace of mind is worth something to some people. Speaking of peace of mind, with this arrangement, you have access to any provider across the country that participates with Medicare, which is a huge plus, and you do not need to get a Medicare Part D plan because your FEHB plan already comes with creditable drug coverage. One big potential negative to consider with this option is additional Part B premium costs, and this can be more nuanced than you might initially think because Part B premiums are income-based. Take a look at this chart with me. As you're looking through this chart, know that these monthly premium costs are per month and per person. If you are single, easy. If you have a spouse, you are each experiencing these costs. For most people, we're looking at the base premium here, and by most, the Centers for Medicare and Medicaid Services puts it at 95% of all Medicare beneficiaries fall into the base premium camp. So you'll need to look at your healthcare needs now and do a little bit of an educated guesswork on what you feel they will be later, and then decide, is paying the extra $2,100 per year in 2024 worth it to get the additional coverage and coordination of care that we just discussed. You can see the income brackets for those filing individually and those filing jointly with a spouse. Notice that it is a much more advantageous situation for joint filers in terms of overall household income. So for single filers, it may be easier for you to run into this problem that we're about to cover. And these ranges are for your income from 2 years prior. Your 2024 Medicare Part B premium will be based on your modified adjusted gross income from your 2022 tax return. They do this look back every year, so your 2025 Medicare Part B premium is based on your 2023 tax return. Here's where things get interesting. If you are a high income earner headed into retirement, let's take the extreme example here of the highest category and $594 per person per month rather than $174.70. That's $420 per person per month difference, and may dissuade you from wanting to pick up that Part B. The extra $5,000 for an individual or an extra $10,000 per year for a couple might make the added financial coverage for Part B just not worth it. You have to decide, is that dollar difference too big for you? Compare that to your out-of-pocket maximum for your FEHB plan if you're in that top income bracket, or we can show you the math for each of the other brackets. And if that extra cost for Part B each year is more than your maximum out-of-pocket, or more than you're comfortable with in fixed costs, it probably doesn't make sense to get Part B. One last little wrinkle to this higher Part B conversation. A family member of mine sold a real estate property 2 years ago in 2022, which means his income for that year put him in the highest Part B bracket for 2024. So this year, he is paying those higher Part B premiums. In 2025, his Part B premiums will drop back to the base amount because he just had the 1 year of higher income, not ongoing years. This will play into your decision as well. If you have an unusually high year because of a sold property or an inheritance or any number of things, you could set aside some of that additional money for your Part B premiums 2 years from now if you do get Part B. And in that year, that extra cost maybe doesn't allow you to break even for that year, but for all of the years into the future, the standard Part B premium might be worth it. Okay, so this option, number 2, keep FEHB and get both Medicare Part A and Part B. A little to potentially a lot more cost from a monthly premium perspective, but the arrangement gives you very strong overall coverage. If you're worried about high medical costs or you're already experiencing high healthcare costs because of maybe chronic conditions, this is an option to consider. If you are not experiencing higher healthcare costs and you don't feel like you need this level of coverage and you are looking for potentially the lowest fixed monthly costs, we move to option number 3. Option number 3 is getting Medicare Parts A and B, suspending your FEHB plan, and getting a Medicare Advantage plan. This math equation will depend on which FEHB plan that you are considering. Look at what the monthly premium would be for you to keep FEHB into retirement, and then compare that with the Part B monthly premium. Again, remember to consider higher income implications as well as spousal implications in these dollar comparisons. Most Medicare Advantage plans have $0 premiums. There are exceptions where they do have a cost, but around 73% of everyone on an Advantage plan is paying $0 per month to have that plan. They usually come with drug coverage, dental, vision, hearing, and other perks, but there are trade-offs to these plans, which we cover in a lot of detail in other videos on our channel. You'll want to look at your maximum exposure to risk. Look at deductibles with FEHB, look at your copays, and look at your maximum out-of-pockets, and then compare those with the Advantage plans in your area. This is something that you can do by yourself. This is also something that we or other agents specializing in Medicare can do for you. Totally up to you. Generally, people who want to do option number 1 or option number 2 in this video really don't need an agent or broker like us to help. If you are considering option number 3, I highly recommend using an agent to help you compare the two. It won't cost you anything, and an agent will help bring in the Advantage plans available to you in your area to compare the costs, copays, max out-of-pockets, look up providers for you, and give insight into the customer service of the Advantage plan companies so that you can make a more informed decision between your FEHB coverage and an Advantage plan. Access to providers is a big one. Whether you do this by yourself or with an agent, please keep access to your providers in mind. And the last big question to cover in this option is, can you re-enroll in FEHB if you don't want your Advantage plan anymore into the future? If you give documentation to your retirement system that you're suspending your FEHB coverage to enroll in a Medicare Advantage plan, you can re-enroll in FEHB if you later lose or cancel your Medicare Advantage plan coverage. However, you have to wait until the next open season to re-enroll in FEHB. unless you involuntarily lose your Advantage plan coverage because the plan is discontinued or you move outside of its service area. In this case, where your Advantage plan is discontinued or you move, you can re-enroll in FEHB from 31 days before to 60 days after you lose the Advantage plan coverage, and your re-enrollment in FEHB will start the day after the Advantage plan coverage ends. Okay, we're on to option number 4 of 5, and that is to keep your FEHB active and get an Advantage plan as well. This is not what many people choose to do, and it isn't something that we would recommend unless you have some quite unique circumstances. Your FEHB plan and the Advantage plan would work very similarly, but remember, to have an Advantage plan, you need to have Medicare Parts A and Part B. So you are paying your FEHB premium, you are paying your Part B premiums, likely no premium for an Advantage plan, but by going with the Advantage plan, you are giving up original Medicare's lack of network, meaning if you have FEHB, Medicare Parts A and B, and no Advantage plan, Original Medicare gives you access to all of the providers nationwide that participate with Medicare. By getting that Advantage plan, you're replacing Original Medicare with the Advantage plan, and now you are needing to stay within the Advantage plan's network with the Advantage plan as primary payer. FEHB will have additional benefits there, but again, this arrangement for the vast majority of people just doesn't typically make a lot of sense. Finally, option number 5 would be to terminate FEHB and get Original Medicare and a supplement plan. We do see this more often than option number 4, but it is still quite rare. This will boil down to the cost of supplement plans in your area, and you'll need to weigh the monthly premium cost and the coverage of your Part B premium, plus your supplement plan premium, plus your standalone drug plan premium, plus dental plans, plus vision plan premiums to start to get an apples to apples comparison of your costs compared to your FEHB plans. And the big kicker here lies in changing your mind. Remember how if you suspend FEHB and get an Advantage plan, you can go back to FEHB during the appropriate enrollment period. FEHB does not allow a retiree or annuitant to suspend benefits for a supplement plan. You need to cancel your FEHB plan to go with a supplement plan, and then you are permanently locked out of going back to your FEHB retirement plans. So again, this option is taken by some, but not as often as the first 3 options in this video. Now, the answers here in this video and the answers to a bunch of other FEHB and Medicare questions are found on the Office of Personnel Management's Frequently Asked Questions page about FEHB and Medicare. There is a link in the description of this video. There is another OPM page that talks about coordination of FEHB and Medicare benefits, including who pays first, working past 65, and other common scenarios. And there is a 160-page guide when looking at your FEHB retirement plan options. All of these are linked in the description below if you'd like to check them out. Please be sure to check out this video right here. Thank you for making it this far, and I will see you over there.